This is the reason why right now, for malaria, if not for artemether and lumefantrine, it's only artesunate. Quinine has been reserved. Do you know why? Because what is quinine doing in soda? And you've been drinking this soda all through, thinking that ladies were thinking that this soda is going to tighten their vagina. Men were thinking that this is the best soda to clear their hangover after a weekend of drinking. And they drink it. Now they are hit with malaria. They go to hospital. Therapy is not working. By the time you realize it, you have cerebral malaria. You're getting crazy. You're getting mad. The symptoms are there. And you're dying from malaria because of the ignorance that we are doing. Read the ingredients. Before you take anything in your mouth, read the ingredients. When you used to we used to know when you vomit that yellow substance, it's just automatically malaria. So when you vomit malaria, we used to say it that way. I'm vomiting malaria. So when you vomit malaria, soda would be ultimate therapy. And now they bring you that soda that has lemon. That soda does not have lemon. It has quinine, actually. Did you know that? I don't know if this is the quinine that actually made us survive, but that soda that tastes as though it's lemon, it has quinine. Google the ingredients of that soda. It has quinine. What is an anti-malarial drug doing in soda? Then you drink it and you say, now I'm feeling good, I'm better. And tomorrow you're walking. And now, when you get malaria again, you've drunk soda that has an anti-malarial drug. What do you think will happen if you get an exposure to malaria again? Resistance. Because you actually took an anti-malarial drug to treat malaria, but the dose was substandard. So this is the reason why quinine has become a serious problem. This is the reason why right now, for malaria, if not for artemether and lumefantrine, it's only artesunate. Quinine has been reserved. Do you know why? Because what is quinine doing in soda? And you've been drinking this soda all through, thinking that ladies were thinking that this soda is going to tighten their vagina. Men were thinking that this is the best soda to clear their hangover after a weekend of drinking. And they drink it. Now they are hit with malaria. They go to hospital. Therapy is not working. By the time you realize it, you have cerebral malaria. You're getting crazy. You're getting mad. The symptoms are there. And you're dying from malaria because of the ignorance that we are doing. Read the ingredients. Before you take anything in your mouth, read the ingredients. What is quinine doing in soda? Why? Anyway, so when you go to the pharmacy and buy that half dose of amoxicillin, when you have a common cold, most colds are viral, but you go to the pharmacy and you tell them, I want amoxicillin plus cetirizine. And then you use that, and then your cold disappears miraculously. You're actually causing harm to yourself because there'll be a day that you'll get pneumonia. And that is the drug that you will need. Remember, amoxicillin is just part of a group of medication, antibiotics that are actually called penicillins. It's a broad class, penicillins. So if you resist one, you resist all of that group, including injections. It doesn't matter. The bacteria is resistant to this group of drugs. It becomes chaotic. All of you, I have pneumonia, give me azithromycin. Oh, COVID, I want to prevent myself from getting COVID, give me azithromycin. And azithromycin is part of a group. So erythromycin is there, azithromycin is there, and clarithromycin is there. Those three are in one group. So if you resist one, you resist all the three. Imagine that. So how will you be able to solve your problems when you get the infection now? Right now, people are using amoxicillin capsules to chew mirror. Imagine that. They buy antibiotics and they use it to chew mirror. Aye. Let's be serious, guys. Let's be serious. So the first antibiotics were actually introduced during the Second World War. And the first gentleman who received antibiotic therapies in form of penicillins. Okay? Most of you know that gentleman who is called Alexander Fleming. That's the gentleman who actually introduced the penicillins in market. So that gentleman actually got a Nobel Prize. But the first person who received this, because remember that there was a Second World War, so people were being shot and the wounds and all that, and the risk of getting infections was there. And antibiotics became the magic therapy. Because when you just get this antibiotic, it disappears. Imagine having to worry about just a wound. Even a bite, when you bite yourself, you just worry about that because you will die. These guys were having gunshots and the bullets, and then now antibiotic therapy is here and it's going to change their lives for the better. Now, in this modern generation, the same antibiotics are being sold over the counter so that somebody who has a wound can just take a vial that has powder of that antibiotic and pour it on the wound. You've seen that? Ile dawa yangu ya kidonda. They pour it on a wound. Then the wound dries. They don't know they are risking resistance. But most importantly, the agriculture business, the agriculture industry. Look, animals were designed to be free range. Chicken were designed to be free range. The pigs were designed to be free range. The cattle were designed to be free range. But we confine these animals in one place. Then it becomes very filthy because they are there and urinating, pooping, and the environment is so filthy. So it's full of microorganisms. And then these animals, we feed them with steroids and very bad foods. Look at chicken. They are fed with very bad foods and the steroids to just fatten. And there are people who actually feed chicken with antibiotics to also fatten. So be careful where you're sourcing your chicken from. That's why this channel exists, to actually help you start saving in order to buy your own farm up country and start living a life there. The life in the city is actually corrupt. Everybody's here to survive. So this chicken, they are there in one place, confined. There are so many of them, and some of them get to break their legs. You see, those chicken that they are fed so much, in 6 weeks, they are already, it's a full-grown chicken, and it cannot even jump. If it jumps, it dies. If there is noise, it dies of depression. And I put up a post the other day when I was saying dogs used to be very lean and fit, and they used to eat one meal a day. But nowadays, walk in the suburbs where these people who have dogs as pets live. Ladies and boys walking with dogs that are so fat, they're even struggling to walk. What do you think those dogs are feeding on? That aside, the chicken, so fat, but the water that they're being fed on, the food that they're being fed on, are actually full of antibiotics, because they know when you stuff them in one place, the risk of them contracting diseases is very high. So they stuff them with antibiotics to fatten them and also to prevent them from getting infections. They call it prophylactic dosing. So imagine they've even made a name for it, prophylactic dosing. So they have doses for prevention of these problems in their chicken. This is because of the food industry, because the food industry wants them to produce this chicken in masses, a lot of them, so that they can feed the appetite that's actually coming from you people. So you are creating the demand, and therefore you're creating problems for yourself. Because when you create that demand, what they do is they have to make sure they feed you with supply. So now the chicken are feeding on these antibiotics, they are fattening, and every after 2 weeks, there's a whole new load of chicken coming out, and is always going into the food industries to make those sausages, to make that crunchy chicken that you eat all the time, that you line on those food palace, to just make sure that you enjoy that crunchy chicken. You're just eating antibiotics at low doses. And as you eat them at low doses, you're actually getting resistance to antibiotics. Tetracycline is fed to cattle, tetracycline is fed to camels, tetracycline is fed to chicken, right? It is the same tetracycline that you take in form of the eye paste, the eye ointment. It is the same tetracycline that you give children when they are born, these new babies, so that it can prevent eye infection and the gonorrhea in babies. But this is the same tetracycline that you used to eat through chicken. So how do you expect your child to survive? They already developed resistance. The bacteria already had resistance to that tetracycline. So your child will still have eye problems. What are we raising? That same tetracycline that is being injected or given to that chicken or that kettle, it is the same doxycycline that you're going to use. Now, look at the irony. This is where it gets interesting. We give tetracycline to livestock, to the cattle, to the goats, to all those animals. And then we come and feed on that beef. And then we say, because you're so quick to tell me, if I tell you to to drink milk that has not been boiled, you tell me, I'll get brucellosis. Okay? So now boil that milk and drink it. And then still contract brucellosis. What happens? You'll go to hospital and you're given 21 days of injections, either streptomycin or you're given injections for gentamicin. But on top of that, you are given doxycycline. Did you know doxycycline is a tetracycline? Did you know that? That tetracycline is just a classification, the broad classification. And tetracycline is the mother of all other cyclines, like doxycyclines. So doxycycline is actually coming from that tetracycline that was given to that animal that actually gave you brucellosis. And then now you're here taking another tetracycline and you expect it to function. It is not going to happen. It's already resistant. The bacteria are already resistant to it. And that's why most of you will go to hospital, treat for brucellosis, and still come back again for another dose. Still come back and test positive for brucellosis all the time. Even though I told you that those tests for brucella, for typhoid, and H. pylori are actually medical scams. But the reality is you will still test positive because this plays a role. There is resistance already. So that therapy is not going to work for you. So please protect yourself. Please stay away from antibiotics unless they are prescribed. I know you will not listen. I know you will not listen. But again, I already told you. So that day you go and buy that antibiotic over the counter, you want to take it for that common cold, you'll remember I told you common cold, most of them can disappear on their own because they are viral conditions, most of them. When you'll be going there to buy that antibiotic, that amoxicillin, to use it to maybe chew your cut, your mirror, you'll remember I said this is an antibiotic and there'll be resistance. And when you get that resistance, you same person who is chewing that mirror, you're weakening your immunity. So you'll end up in hospital. What drug do you expect them to give to you? You expect them to give them benzoyl That is still a penicillin. It is the same to amoxicillin. So you're thinking this injection will be different. It will not be different. It's same. The formulation is the difference and also the route of administration. So you expect to die in that hospital, and then you start saying, "Oh, this hospital does not have drugs. They have drugs, but you are resistant. Your these antibiotics are already resistant. The bacteria are resistant to those drugs, so they cannot help you." So as you eat that chicken, that is that broiler, just know it has been fed with steroids. Those steroids weaken your immunity. It has been fed with antibiotics. Those antibiotics will weaken your immunity because they will kill the bacteria in your gut. And there is a relationship between those microorganisms in your gut and mental health. Do you remember me telling you to fix your gut when you're trying to heal from mental health conditions? Do you remember? Right now, most people are depressed. They are not depressed. They've been diagnosed with depression. And they believe they are depressed. And instead of them fixing their gut, they still go and take antidepressants that will actually destroy the gut even further. So do you think you'll ever walk away from the big farm? They will have you as a slave for a lifetime because you have a problem. They have made you believe that problem. They have now given you drugs that will worsen the problem. So you'll still go back for more drugs. And that's why when you ask your doctor, when will I recover from this depression? He tells you, this one, I don't know. He might not tell you directly, but he will tell you, this one, I don't know indirectly. So it's up to you to figure out what is he saying. Yeah? The same doctor who told you depression is idiopathic. It has no known cause. The same doctor who tells you, I don't know how long you'll treat this depression. Just be consistent with the drugs. Just be consistent with the drugs. And whatever comes out of it will be okay. So I want you to know this. Antibiotics are very important because one, they help you in wound healing. Number two, in that tooth extraction process, you need an antibiotic for prophylaxis. Number three, every surgery and every transplant relies on antibiotic, including CS, including kidney transplant. Every single one of them relies on antibiotics for prophylaxis, prevention of infection. Number four, every person who is immunocompromised, this is the HIV people, This is the diabetics. This is the people who have cancer and are on chemotherapy. They need antibiotics for them to survive. Number 5, when you're giving birth, that new baby, and even those premature babies that are being born every single day right now, they rely on antibiotic therapy for them to be better. They need antibiotic therapy for them to be better. So if you continue messing up, you're actually affecting the life of those babies. And we know we cannot all of us live a healthy life, but we need to be very vigilant. Number 6, imagine if you contract a sexually transmitted disease or infection. Do you know how stubborn it is? If you don't get that antibiotic, how will you survive? Skin conditions, they need antibiotics. Imagine that. So all these conditions are actually tied up. Even people who have a risk of stroke and they want to be put in those stents. Imagine that. You have to actually use antibiotics to prevent them from getting infection. Dialysis depends on antibiotics. So imagine all these things, you can never miss on one. You will have either one or two or even all. So you need an antibiotic. But you need antibiotics for a specific period of time. Make it even shorter. And they have to be prescribed. Because antibiotics therapy are necessary, yes. But as I told you, their role is not to help you heal. Their role is to lower the bacterial load to a certain level and then allow your immune system to take over. Don't be lied by that word, bacteriostatic and bactericidal. Simply understand your immune system plays a very important role in managing diseases, in treating infections. You need your immune system fixed. And we've talked about how to fix immune system through fasting, through eating healthy, through exercise, through the sun, through cold showers. All those things that we've talked about on this platform. Exercise them. Such that even farmers are using harmful herbicides on veggies and even injecting animals, not just poultry, with steroids to fanya nini. So the reality is this: there's much that you can do. You cannot solve every puzzle, you can't, but there's much that you can do. Do it. You can't ask that question when your supper right now was ugali, sukuma wiki, and some 2 pieces of meat that has been fried in seed oils. You can't ask that question if you have never fasted before. That when you fast, you have low energy. You will die when you fast. You have ulcers, so if you fast, you will die. You can't. You can't ask that question when you are overweight. You can't ask that question when you're having hormonal imbalances because it's an indicator there's a problem. You can't ask that question when you never exercise. You can't ask that question when you're afraid of running through the rain because you think the rain will give you asthma or pneumonia. That is a question that you should ask when you are actually doing something. You're eating 2 meals a day or 1 meal a day, so you're reducing the exposure. Number 2, you're fasting, therefore you're boosting your immunity, so you will not need antibiotics. Number 3, you're reducing the exposure through skin products, so you're not applying those sunscreen and all those products of the skin to lighten your skin. Number 3, you are always exercising. It doesn't matter if you're going to the gym or doing home workouts or walking. Number 4, you're doing cold showers without complaining whether the weather is sunny or it's cold. You're doing a cold shower. You're sleeping healthy. You're having 8 hours of sleep every night. That is therapy. So when you should be asking me, what else should I do if this, because the market is dirty. We cannot do anything. Imagine those counterfeit trucks coming in through the porous borders every day. They come through those porous borders. But can you do anything about it? The Pharmacy and Poisons Board is there to control this, but does it do it? Let's be honest, does it do it? It will do a crackdown once. And when it does that crackdown once, it will target the small business owners, the small chemists, so that it can use them as an example to other small chemists. But does it target the bigger fish? It doesn't. Those bigger pharmacies are owned by politicians. How can you touch them? They are owned by people in the Pharmacy and Poisons Board in Kenya. So how can you touch them? But they will use one person as an example. They'll post that person in a magazine. They will post them on television. They will show them through the mainstream media so that they act as an example to other people who are trying to destroy their businesses. That's the idea. So it comes in with an ill will. It's not a genuine idea to change your life. Look at your Bureau of Standards. Today allows in and this seed oil. Tomorrow is saying this seed oil is bad. The other day, the same seed oil that was bad is good. Today they announce on TV that sugar has mercury. Tomorrow the sugar is clean. It has to be used. So antibiotic resistance has been a serious thing. And sometimes I look at it and you cannot complain enough, because even if you complain, who are you complaining to? Sometimes you see somebody buying 5 capsules of amoxicillin and you just wonder. Sometimes you see somebody taking these drugs and just takes 2 doses and they're done. They take them today, take in the evening, and that's it. Sometimes I see them being told 2 times 3, and the interpretation of that goes straight into 2 times 3, mbili asubuhi, mchana na jioni. You divide your day into 3 and you take in the morning, at noon, and in the evening. That's it. You're messing up. There is a reason why you take a drug that way, because when it's designed to be taken every after 8 hours, this means that drug has to take 8 hours to attain a certain therapeutic level and then starts going down. When it starts dropping into the blood, in the plasma, you can now top up the dose so that you have that stable curve and that maintenance, so that it helps you reduce the bacterial load. But when you're taking it that fast, one, more side effects. More side effects of that drug. So toxicity will be there. Number two, you're actually wasting it. You're destroying yourself. But God was special. God designed you perfectly, that your system has to heal on its own. But you have to learn lessons, because when you take antibiotics, most of the times you get a diarrhea. Why do you think you're getting a diarrhea? Because you killed both the good and the bad bacteria. Now you suffer the consequences. And I repeat, after every antibiotic therapy, make sure you take either kefir or fermented cabbage or kimchi if you can access it. They will help you fix the gut back. They'll bring back the microorganisms, or even fermented milk, but don't boil it. Don't buy yogurt. Yogurt and fermented milk are not the same. Mala is not fermented milk. So they mess up your gut totally. Antibiotics mess up your gut totally. Therefore, you should not take antibiotics for the longest period of time. And if you're a medical practitioner and you sit in a hospital and you see a patient taking antibiotics therapy, even injectables, for more than 5 days, and there's no improvement, why are you still giving them antibiotic therapy? Please consider talking to the pharmacist to just help you to change the medication. But again, the pharmacist on the other side, they are just 2 times 3, 2 times 3, 2 times 3 every day, 2 times 3. 2 times 3, 2 times 3. They have stuck on that window, just dispensing. Where is medication therapy management? Where did that go to? Why did you go to school to study all these 5, 6 years to study and understand medicines, just to come out and stand on a window and dispense 2 times 3? Why?